Hey, good morning, YouTube. It's Tuesday. Wait, let's check with Alexa first. Alexa, what's today's date?
It's Tuesday, November 14th.
Alexa, what's the temperature in Tampa Bay today?
Right now, in Tampa, Florida, it's 77 degrees Fahrenheit. Today, expect a high of 82 degrees.
Get better. Alexa, what time is it?
It's 9:57 a.m.
Thank you. Okay, so we got all the factoids. Now, this video is me actually talking about something more, I don't know, like what do you serious or something more important than my typical ramblings. I'm going to talk today about medical concerns and uh, mental health issues. Because I've talked to many people, um, and I mean, a lot of people have called me crazy, and I accepted that terminology. But I mean, I've been diagnosed with mental health problems by professional doctors, and this diagnosis and this issue has been a major theme of my life for many years before my marriage, during my marriage, and even uh, even today, it's still an issue. I have had various diagnoses. I have been diagnosed with depression, bipolar, MPD, schizophrenia, and PTSD. Those are all the different things that I've been diagnosed with. Well, they don't, they're sort of, they were a little bit on the fence about schizophrenia. They called it schizoaffective. But, and the MPD was sort of not, I don't think the MPD was actually written on my records, but, it was sort of discussed. So anyway, these are the diagnoses. And then I've talked to philosophers who question diagnoses and psychology as a medical practice, or there's a lot of different people with different opinions about psychology as a medical practice. And I've listened to all kinds of people talk about it, doctors, philosophers, and I I'm just going to share my opinions after dealing with this for about 30 years. I've been dealing with this. The diagnoses have happened about, you know, maybe less than 30 years ago, but I have been dealing with this for about 30 years. So, my opinion is that the psychological definitions and the psychological diagnoses are correct. They are correct. Now, you know, it's easy to call me crazy and say I'm wrong, but I believe that they are correct. I have looked at the definitions, I have seen the behaviors from me and other people diagnosed, and those are accurate descriptions. So that part's right. And as far as it being a medical practice, yes, I believe it is. Even if the medications do or don't work for various patients, and sometimes they do and sometimes they don't. I know this from experience. But even with or without the medications, it's still, in my opinion, a medical practice because of the counselors. The counselors, with or without certification, make a difference to mental health patients. They make a difference. It's as simple as I have a sore shoulder and someone massages it and makes it feel better. Okay, that is a healing aspect. I don't need a professional certified masseuse to massage my shoulder. I'm sure maybe they could do it better than a non professional, maybe not, but I don't need that. If my shoulder hurts and someone rubs the pain out, it's just as effective. And counselors do that for mental health patients or mental health uh, issues. Okay. So I'm going to say that it is a medical practice, in my opinion. and the definitions that they've used, the terminologies that they've used, I think are correct. As an English person, as a person who used to be an English teacher, I want to validate that. Now, on a personal note, dealing with my own mental health issues for 30 years has been no easy task. I have been on many medications. Some worked for a while, some didn't work at all, some, uh, you know, faded out, uh, some quicker than others. And they told me, some of the doctors knew that could happen. They told me that it's sort of a guess when it comes to the medications for mental health issues. Well, this worked for these people, so maybe it'll work for you. That's kind of how they do it, you know. So it's kind of tricky on that, But whether you are medicated or not, the behaviors are really, in my opinion, the behaviors require mm, ways in the individual's mind that you have to develop in your mind to deal with whatever behavior is unacceptable to you or others. Yeah. So you have to develop that. And counselors can help you with that, with or without the medication. Counselors can help you with that if you let them. Um, I mean, now there were addicts, and I have an addictive personality. I'm not the only one, but I have an addictive personality. Um, and when you have an addictive personality, there are a lot of pitfalls in life. You know, there's ways to overdo anything. And now a philosopher will say moderation is a good way to live. And it is. He's not wrong, right? If he says that. Well, if you have an addictive personality, you go overboard all the time on whatever it is your next addiction is. So there's lots of groups for that. There've been lots of groups for that, right? There's been AA for people who went overboard with alcohol. There's been Narcotics Anonymous for people who went overboard with whatever drug they were doing. And, they're going overboard, meaning they were so addictive that it was having a destructive influence on their life. Or so, and so they had to do something. They had to put the brakes on some way, and counselors and some form of a practice or method to help them, stop their destructive ways was supposed to, help them because they have an addictive personality and they got addicted to something. So, why I mention this is because the medical world cannot solve every single person's problem every single time. Sometimes we have to just tolerate our own stupidity, and sometimes we have to, deal with it on our own because whatever answer they have isn't working for us at that moment. And that's not easy, you know. It's nice to think that there's one answer that always works, but it's not always like that. But that doesn't mean that counseling or psychology isn't effective, or that counseling and psychology isn't a medical practice. Um, it's too uh, not caring enough. It's not caring enough to pawn off, to say, well, that's just psychobabble. Don't shrinkinize me. That's not a kind thing to say, because if someone is shrinkinizing you, it's their way of caring about whatever it is, they think is the problem, because that's how somebody cared about them. So when you say, don't throw that psychobabble at me and don't shrinkinize me, you're not validating the way they've been cared for. And that's really rude. It really is. So I just wanted to validate psychology because I have used the term psychobabble, when I was upset about various medications that were prescribed that didn't work for a problem I had, or when I was in disagreement about various methods in some of the counselors' ways. If I disagreed, I would want to throw that term out there, that psychobabble, those shrinks that don't know what they're doing. Yeah, we get upset and we say those things, but I don't want it thought that I do not validate psychology as a medical practice. I do think it's a legitimate medical practice, and I've been dealing with these kinds of issues for 30 years, which some would say that I might be a good counselor for others because of that. Just like a recovering drug addict or a recovering alcoholic is a good, mentor or counselor for those who want to beat that addiction. Um, so if you're new to my videos and you are suffering from mental health issues and you need any guidance on that, I might be able to help, even though you have to know that people call me crazy. But it's just me being crazy that might be able to help you through it if you're finding out that you have some issues like that too. So if you do, I hope that you'll take a deep breath and look for help wherever you can find it, and don't dismiss that aspect of the medical world, because it can be helpful and it has helped me as much as I might complain about some of their methods. So that's all I wanted to say. Hope that helps some of you.